Welcome everyone. Hello, I'm Dr. Timothy Dauwalder, Executive Medical Director of VNA, Hospice and Palliative Care of Southern California. I and the VNA have been together for more than a decade, nearly 2 at this time. And it's my pleasure to introduce the Uneventful evening of fundraising that gets initiated this month, September 24th on YouTube. Charitable care are used for many, and those funds rather, are used for many things. Charitable care funds are used for those that don't have insurance. As you know, Medicare over 65 has a hospice benefit, but not all those that suffer and have 6 months or less to live are under the age 65. So who pays? Well, there are private insurance providers, but not all of them have a hospice benefit. And if so, it can be a limited benefit, leaving gaps. And then there are those that even with a hospice benefit, hospice is about medical delivery systems and plans of care. It is not about a place to live. It is not about food. It is not about daily caregiving. So the suffering beyond the benefit that this nonprofit organizes of hospice care and palliative care is a huge deficit of actual need. And how is that met? That is met through nonprofit philanthropy, and individuals like yourselves giving and caring. None of us are enough alone. The VNA is not enough alone. I am not enough alone, and you are not enough alone. Together, we can organize funds and resources to diminish suffering for those in greatest need and those most vulnerable and those that have no voice. If we can, and we're not asking for anything major, we're just asking for you to think about it first and then consider, do I or does someone I know have money to give to a charitable fund to help eliminate suffering? It's easy for someone to ask in a fundraising way to give money, and too often those funds are not used ethically or appropriately. We are held to a high level of accountability at the VNA to use your money directly, gift cards for babies and infants and mothers, shopping baskets, personal care needs, ability to hire caregivers, home health aid needs, medical supplies, the list goes on and on. And again, I want to reiterate that people act as if hospice is a benefit that is paid by all for all. And in a perfect world, that would be true. But if you are over 65 with Medicare, that is true. You have the benefit. But even then, personal needs are not met without funds. So that's one group. The other cohort in this scenario is that those under 65 may not have coverage at all. And we actually have to do our hospice care, which we do, sending nurses out, durable medical equipment, medicines delivered, nursing visits, home health aid visits, doctor oversight, and likely visits, all done for free. That is a lot of mobilized hospital level care to a patient for absolutely no cost to the family because they have no resources. So we have charitable care patients that need your help, let alone all the needs I mentioned before of suffering needs of those with the benefit. Look at the suffering that needs to be addressed to minimize for those that don't even have that. And unfortunately, the demographic that meets the absolute no resource category are infants, newborns, children, adolescents, the mentally ill, and those under 65 that are underinsured or do not have insurance. So that is a lot of our population. So all I'm asking is that you consider, if not this year, then perhaps next year, or perhaps in 5 years, that $100, a $10 a month, whatever you can give is extraordinarily beneficial. And if you were to see the faces, and I wish I could show you, that when you give a gift card to a mother that she can buy briefs for her well baby, let alone care for the one that's dying, how much suffering that eliminates, how much guilt that relieves from that mother. So what I hope that you will consider is to donate in this charitable cause to the VNA Hospice of Southern California, often known as VNA Hospice and Palliative Care of Southern California, so we can better care for folks, because alone I can't do it. I humbly realize you do not, I do not. The VNA does not take away all the suffering we want to take away. So I really appreciate you listening. I hope I didn't ramble too much and that I made some sense to you, and that my plea felt earnest, honest, and appropriate, because it is from my heart, and I do strongly believe in this cause, and I really appreciate you just considering it. Thank you very much.